Hello and welcome. Today we're diving into a less commonly discussed, yet significant, heart condition, autoimmune pericarditis. This isn't your typical heart disease story. It's about the body's own immune system turning against a vital organ, leading to inflammation and potential complications. Join us as we explore the causes, symptoms, diagnosis, and treatment of this fascinating and sometimes challenging condition. So, what exactly causes autoimmune pericarditis? The answer, as with many autoimmune diseases, is complex and not fully understood. Essentially, it arises when the body's immune system mistakenly identifies the pericardium, the sac surrounding the heart, as a foreign invader. This misidentification triggers an immune response, leading to inflammation. Several factors can contribute, including underlying autoimmune diseases like lupus, rheumatoid arthritis, or Sjogren's syndrome. Previous viral or bacterial infections may also act as triggers, initiating an autoimmune response. In some instances, certain medications or even cancer can play a role. However, in many cases, the exact trigger remains unknown, making diagnosis and management more challenging. Now, let's delve into the pathophysiology. The initial trigger, whatever it may be, sets off an inflammatory cascade within the pericardium. Immune cells infiltrate the pericardial sac, releasing inflammatory mediators like cytokines and antibodies. This inflammation causes the pericardium to thicken and become irritated. Fluid may accumulate within the pericardial space, leading to a pericardial effusion. In some cases, chronic inflammation can result in scarring and thickening of the pericardium, a condition known as constrictive pericarditis. This thickening restricts the heart's ability to fill properly, leading to reduced cardiac output and symptoms of heart failure. The degree of inflammation and scarring dictates the severity of the condition and the impact on heart function. Autoimmune pericarditis is relatively rare, making it difficult to pinpoint precise epidemiological data. Its occurrence is often intertwined with the prevalence of the underlying autoimmune diseases that contribute to it. Individuals with conditions like lupus, rheumatoid arthritis, or inflammatory bowel disease are at a higher risk of developing pericarditis, including the autoimmune variant. It can affect individuals of all ages, although it appears to be more common in young to middle-aged adults. More research is needed to accurately determine the true incidence and prevalence of autoimmune pericarditis within the general population. The signs and symptoms of autoimmune pericarditis can vary depending on the severity of the inflammation and the presence of any associated complications. The most common symptom is chest pain, often described as sharp stabbing or atching. This pain may worsen with deep breathing, coughing, or lying down and can be relieved by sitting up and leaning forward. Other symptoms may include shortness of breath, fatigue, palpitations, and a persistent cough. In cases of pericardial effusion, you may also experience lightheadedness, swelling in the legs and ankles, and abdominal bloating. It's important to remember that these symptoms can mimic other conditions, making accurate diagnosis crucial. Diagnosing autoimmune pericarditis requires a comprehensive approach. A thorough medical history and physical examination are essential, paying close attention to any underlying autoimmune conditions or recent infections. An electrocardiogram, or ECG, is usually performed to assess the heart's electrical activity and detect any abnormalities associated with pericarditis. An echocardiogram, an ultrasound of the heart, is used to visualize the pericardium and detect any thickening or fluid accumulation. Blood tests can help identify inflammatory markers, such as C-reactive protein and erythrocyte sedimentation rate, which are elevated in pericarditis. Importantly, blood tests can also help identify specific autoantibodies associated with certain autoimmune diseases. In some cases, a pericardiocentesis, where fluid is drained from the pericardial sac, may be performed for diagnostic and therapeutic purposes. The fluid can be analyzed to rule out infection or malignancy and to further characterize the cause of the pericarditis. While we don't typically classify autoimmune pericarditis into strict types in the same way as other diseases, it's helpful to consider its presentation in terms of acute, recurrent, and chronic forms. Acute pericarditis is a sudden onset of inflammation. Recurrent pericarditis occurs when symptoms return after an initial episode. Chronic pericarditis persists for longer than 3 months. Additionally, we can categorize it based on the presence or absence of specific complications, such as pericardial effusion or constriction. These classifications help guide treatment strategies and predict the long-term outcome. The treatment of autoimmune pericarditis aims to reduce inflammation, relieve symptoms, and prevent complications. Non-steroidal anti-inflammatory drugs, or NSAIDs, are often the first line of treatment to reduce pain and inflammation. Colchicine, an anti-inflammatory medication, is frequently used in conjunction with NSAIDs to improve outcomes and prevent recurrence. In more severe cases, or when NSAIDs and colchicine are ineffective, corticosteroids may be prescribed to suppress the immune system. Immunosuppressant drugs, such as azathioprine or methotrexate, may be used for long-term management, especially in cases associated with underlying autoimmune diseases. If a significant pericardial effusion is present, pericardiocentesis may be necessary to drain the fluid and relieve pressure on the heart. In rare cases of constrictive pericarditis, surgical removal of the pericardium, known as a pericardiectomy, may be required to improve heart function. While we can't entirely prevent autoimmune diseases, there are steps you can take to potentially reduce the risk of developing autoimmune pericarditis. Managing underlying autoimmune conditions effectively is crucial. This includes adhering to prescribed medications and attending regular check-ups with your rheumatologist or other specialists. Practicing good hygiene, getting vaccinated against common infections, and avoiding exposure to known triggers can also help. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management techniques, can contribute to overall immune system health. If you experience symptoms of pericarditis, such as chest pain, seek prompt medical attention for accurate diagnosis and appropriate treatment. The prognosis for autoimmune pericarditis varies depending on the underlying cause, the severity of the inflammation, and the presence of complications. In many cases, with prompt diagnosis and treatment, the condition can be effectively managed, and individuals can lead normal, healthy lives. However, recurrent pericarditis can be a challenge, requiring long-term management and monitoring. Complications such as pericardial effusion and constrictive pericarditis can impact the prognosis and may require more aggressive interventions. Recent research focuses on identifying specific biomarkers to predict the risk of recurrence and developing targeted therapies to modulate the immune response more effectively. Clinical trials are also exploring the potential of novel anti-inflammatory agents and biologic therapies to improve outcomes in autoimmune pericarditis. As research continues, we hope to gain a better understanding of this condition and develop more effective treatment strategies in the future.